Hello, my name is Dr. Robert Groysman, and today I wanted to discuss a question I see posed in comments on social media, and that is, can't I just use a neti pot instead of doing the EAT procedure? Now, the EAT procedure stands for Epipharyngeal Abrasive Therapy, and it is a procedure that is done with a flexible camera endoscope that is advanced to the back of the nose and throat, and then a swab is also inserted, and the back of the nose and throat are abraded, and zinc is applied. So let's look at some of the differences between the neti pot and the EAT procedure. So first, the neti pot is meant for rinsing your nasal passages to remove mucus, allergens, and irritants in the front part of your nose, that is the nasal cavity itself, and the front part where the sinus is open. Whereas the EAT procedure targets the back of the nose and throat, the epipharynx, and can stimulate the local autonomic nerves that are located in that area. So let's look on a model kind of where each procedure does its work. So the neti pot flushes this front part of the nose, the nasal cavity, and a little bit of this middle part of the nose, whereas the epipharyngeal abrasive therapy targets this area right here. This entire back area, this is where the lymphatic tissue is. This is where the mucosa that contains IgA producing cells. This is where the remnants are trapped behind a layer of mucus and behind biofilm. So, really, the only way to get rid of this area that's chronically irritating and causing your symptoms is to physically abrade it or rub it. To put it simply, these procedures, the neti pot and the EAT procedure, serve very different purposes.